you guys splitting this place with somebody else?
Well, they're just using it as a video.
What was it, the name of the, like, what was it?
Light pump.
That's right, yeah. Light pump?
Mm-hmm.
Heck yeah.
Is that what this whole lighting thing is?
Mm-hmm.
It looks like a spaceship.
They know that's what I said.
I feel like I'm able to keep
It's like, what does
attention.
that button do on the
I,
side?
yeah.
Yeah, I don't know. They smile whenever I ask them that question. And there's another thing over here they connect as well. But this is the first start. It's like a diagnostic test. And then from there, they take whatever info and then they put you on a table over there. And then from there, they have you hooked up to headphones and then they blind you. And then they put that weighted blanket on you. And then from there, they do audio. I don't know, it's like songs, and the whole table's built up with vibration and like speakers, and so right there, and then they take you up,
I was like,
try to get into your
it looks like it's
subconscious,
really
and then
bad,
from
but I'm
there,
like,
they might have
I
visuals
like
too,
that.
so they have like a
yeah,
VR.
right there.
The bigger picture is that they'll have like this Jaguar head, and it's like connected to like these videos, and there's like 5 to 6, 7 people lined up all in a row. They're just basically seeing this video, and they're like filtering like music and audio. And so for Baldo, it was a 23-minute like ordeal, and then the last 7 minutes was audio clips saying like, "We love you. This is why we think you're great. You're blah blah blah, you're wonderful, blah blah." And they pieced it together. So that's like was just blasting him after he had like 23 minutes of just vibration. And like so they're really trying to get into the subconscious and address a lot of those issues, especially like PTSD, schizophrenia, depression, all that stuff as well. But they want to include like IVs and shots with it as well, which, yeah, why not? So I got to experience a little of it. It was pretty cool.
That's pretty rad.
Yeah. So cool. I guess we'll go ahead and start. I'm recording over there. We're recording here. It's going like directly on Izzy.
Right
or
away.
Yeah.
Teaching.
Yeah, cool. All right. So for everyone watching and listening, thank you for coming again, and people in person, for returnees, which is great. This is our 5th one now, our 5th Lunch and Learn, and to the new people, thank you for coming. We'll have some stragglers probably come in here later. Today's topic is the 5th installment, and this one is called heart disease. And I really didn't know how to title this because I didn't want to actually cause too much commotion, but I wanted to grab your attention. So basically, like heart disease, is it cholesterol is not really the main issue, right? It's basically what you just need to think about. So in my line of work, I'm a family nurse practitioner, and I'm also a chiropractor. So it goes hand in hand that I talk about heart disease on a daily basis because it's something of still an epidemic in this country. With every talk that we've kind of encountered so far, it mixes in 2 different issues, right? Depression, anxiety was one of them, hormones in men and women. And so today, heart disease is not necessarily going to mix in with one particular thing. Heart disease is a byproduct of whatever other dysfunction is going on in the body, right? So think about the acronym genetics, inflammation, and nutrition. That's kind of how you have to think about life in general when it comes to health issues. So when it comes to things like cholesterol, that has been a staple in heart disease for years, and it still is kind of the go-to treatment when it comes to heart issues. Okay, so what is heart disease? Heart disease can be anything from a heart attack to a stroke. It could be coronary artery disease. It could be atherosclerosis, which is narrowing of the arteries and basically scarring, plaque. You think about that as well. There could be clotting disorders. There could be electrical impulses, arrhythmias. There could be murmurs. There could be issues where one of your chambers didn't grow when you were a baby. There's all kinds of things that you can think about. And I should have brought the heart today, but I have this little heart in a display at home, and it's incredible because if you really think about it, our heart is a muscle. Okay, it's a cardiac tissue. And when you have this muscle, it's working for you every single second of the day, and you don't even realize it until you feel your heart rate, or you take your blood pressure, or right, you feel some chest pain. It is essentially squeezing and pumping out blood to your entire body. And when it does that, it serves a purpose. It takes in blood and it ships out blood. Think about it as almost like a port. All right. So when blood goes into your body, and I shouldn't even say blood goes into your body, when blood is created in your body, it filters out through the entire system. The heart has to be big enough and strong enough to pump out blood to the rest of the body. But what is the purpose of pumping out blood to the rest of the body? Is to get nutrients. All these things, when they get ingested into the body, have to eventually get broken down, gets absorbed in the gut. After it gets absorbed in the gut properly, it goes through the bloodstream and it gets carried up to the heart. Okay. Now, the incredible thing about the heart is it works hand in hand with the lungs because the lungs oxygenate the blood. Once the blood is oxygenated, it gets pumped out of the blood and it goes to the rest of the body, ready with the nutrients to basically meet and give whatever nutrients are needed to the body. It goes to the liver, it goes to the kidneys, it goes to your toes. Once it's used up, the body brings the blood back through what's called the venous system, the lymphatic system. And it basically returns or deoxygenated blood back into your body, ready to be recycled again and used and be filtered in with new nutrients. So goes away, has nutrients, comes back, no nutrients. Goes away, has nutrients, comes back. Recycle over and over again. There's red blood cells, white blood cells in there. There's B12, there's magnesium, there's zinc, there's copper, there's whatever you can imagine this blood. Why are we talking about blood over the heart? Well, the thing is the heart basically is filtering and pumping this blood out, so it has to be working in sync. What's incredible about it is people don't even realize that there's electricity that runs through the heart. There's these fibers that are actually at the bottom of the heart, and they do an electrical impulse that causes your heart to squeeze. And when it squeezes, it's basically pushing all the blood out, and it's an injection. Your heart is so strong that it basically has a shotgun at the end of it in the left ventricle that goes into something called the aorta. And the aorta is a huge artery, right? And it pumps out blood to the rest of the body. So if you think about this, the electricity goes to your heart is basically making the heart contract, which is incredible. And you think about people that have murmurs, their rhythm is off. You think about people that basically have AFib, if you ever heard of that. AFib is electrical impulse dysfunction. They're so stressed out that the impulse and the rhythm of the heart is off because it's supposed to be in rhythm, but then stress comes in, and it's like, no, slow down. And so it throws off the electrical impulses. That's arrhythmias, which is incredible. And if you look up AFib, atrial fibrillation is basically one of the incredible things that can lead to you just dying at a very young age. And it's something that you were probably most likely born with, but also lately it's been more of like it's acquired. Like your stress in your life is so bad, eventually it causes your heart to go into dysfunction. Let's mix in stroke and cholesterol. All right, so let's go back to the cholesterol issue. As you can tell, that has nothing to do with cholesterol, right? Like if you have an electrical impulse that's off, it's not going to be affected by your cholesterol. But here's the thing. Most people, when they go to their regular doctor, they look at their cholesterol panels, right? It's one of the standard things that you look at when it comes to blood work. You have your total cholesterol, you have your HDL, which is your good cholesterol, you have your bad cholesterol, which is your LDL, and you have your triglycerides. It's been standard. All of us have cholesterol. It's not like we eat cholesterol and then we have cholesterol in our body. No, we always have cholesterol in our bodies. Your dietary cholesterol only makes up about 20% of whatever cholesterol is in your body, and the rest of it's genetics. So when you have the term people make bad cholesterol, it is true. It's true to a certain extent. But think about this. Cholesterol is your precursor to all your hormones. So the last thing that I'd ever want you to do is to go on a low-fat diet. Because if you go on a low-fat diet, you're going to restrict your body's ability to make that 20% of cholesterol that you need in order to contribute to things like hormone production. If you go to the source of your food, let's say that 20% of your diet comes from avocados and salmon and almonds, you're probably going to metabolize it very well, hopefully, and then eventually you kick out some good cholesterol like the HDL. If you basically consume a bunch of canola oil, peanut oil, corn oil, trans fats, partially hydrogenated fat, high fructose corn syrup, like bad fat, right? Barbecue fat. If you consume that, it gets metabolized into inflammation. Okay, and that's the real culprit here. Years ago, when they said stop eating butter, stop eating red meat because it can kill you, they were half right. It's incredible because nowadays you have people that load up butter on a keto diet because it's healthy fat. Avocados are one of the most perfect foods in the world, if not the most perfect food in the world, right there with turmeric, because it has healthy fat. It has monounsaturated fat. Monounsaturated fat is the healthiest fat in the world. It gets converted into most likely healthy fat like HDL. It gets converted into healthy hormones like estrogen and testosterone. Along those pathways of breaking this down and metabolizing it, if you have any genetic malfactors, or maybe you have a nutritional deficiency, the conversion of cholesterol to things like hormones could cause byproducts of inflammation. That's the real issue when it comes to heart disease. It's not the cholesterol is going to be an issue in your arteries and clog you up. The thing is all the freaking corn oil that those people eat and the high fructose corn syrup, it basically inflames the lining of the heart. Because remember, the blood has to carry all this stuff, right? So whatever it's carrying through the tunnels of the walls of the arteries, it's going to affect it, right? So imagine if I'm trying to go through a narrow hallway and I'm carrying like a big stick with pointy ends. If I happen to bump into the wall, I'm going to cause a little damage. Well, imagine that's what red blood cells have when they have cholesterol. And if it's like corn oil or canola oil, it basically pokes at the lining of the walls. If it's sugar that's also going in with it, it's also poking. Avocado fat really doesn't poke the walls. Salmon fat really doesn't poke the walls, right? That's the difference in the fat. So if you have something that you're eating that's causing inflammation, you probably should cut that out of your diet. But let's go back to genetics. 80% of it, right, really makes up your cholesterol. Why do I keep focusing on cholesterol? Well, the thing is how you metabolize. Cholesterol is like essentially a precursor to how you function, right? You have sugar in your body, right? Blood glucose, we measure through a finger prick test. We measure cholesterol almost like it is a way to look at how you're protecting your heart, but it's not the case. All your cholesterol actually gets made in your liver. That has nothing to do with your heart, which is fucking incredible. Because if you think about it, why the hell is the heart disease going to be connected to liver? It's because this is filtering out all the food that you're eating. And genetically speaking, if you have a hard time doing it, you're going to inflame the heart, right? So imagine that cholesterol is not the issue when it comes to heart disease. And if someone is really treating it and addressing it that way, they're kind of missing the boat, right? Because it's the inflammation. If you're treating someone that has cholesterol issues, the term is called hyperlipidemia, right? And it's basically the idea that they have high and bad cholesterol. And if that's the case, the medication that's typically prescribed is a statin, okay? A statin lowers bad cholesterol, like the LDL. It lowers the total cholesterol. Excuse me. Sometimes it can even raise your good cholesterol. So if a person comes in and they're on cholesterol medication, they're typically saying, I am a cardiac patient. I am at risk for heart disease, heart attack, stroke. I'm on a cholesterol pill. That should take care of it. They're also probably put on a blood pressure pill because blood pressure that's high usually comes with high cholesterol. If you're put on those medications, it's the standard, typical, traditional route to treat heart disease. But what will happen is that person still might succumb to a heart attack. And then you say, why? Why did this person have a heart attack after they put on cholesterol medication to protect them? The cholesterol medication, just like any medication, causes weird side effects. And one of the things it lowers is CoQ10. If it lowers CoQ10, that's an antioxidant that protects your heart, your eyes, and your brain against damage. So now you have a medication that you're taking to protect your heart. And what it's really doing, it's actually causing something to be deficient that could actually protect your heart. So it's weird because you don't typically hear physicians say, take a statin and then take CoQ10 with it. But it's almost the same thing as saying, take a probiotic every time you take an antibiotic, because it goes hand in hand, right? If you take a blood pressure pill, you're trying to lower hypertension, which is essentially saying you have too much pressure flowing through your body, and what it's doing is overworking the heart, okay? Nothing to do with cholesterol, nothing to really do with electrical impulses. They're just saying for some reason you have a lot of blood flowing through you. Now, all of these things look like separate, but let's look at the bigger picture. If somebody has genetic issues where they metabolize their cholesterol differently, there's a marker that you can check to see if there's something really going on with them that's going to show you a bigger piece of the picture than just cholesterol. Cholesterol doesn't tell me a whole lot. It just says, hey, here's what's going on with you right now. Genetically, you might make bad cholesterol. Do I have a risk for heart disease? I don't know. If I look at something called homocysteine, I can see if you have inflammation building in your heart. That's a marker. There's a marker that you go to the hospital, it's called troponin. If you have a heart attack, they can run this marker and see if you have cardiac damage. It's incredible, it's very sensitive. But the in between there is like, what do I check to make sure, I am not going to have a heart attack down the road, right? Well, that's where it comes into a lot of genetic factors. It comes into things like homocysteine and inflammation markers, and then nutrition. Amino acids and vitamins are vital for cardiac tissue health. Okay, we already mentioned CoQ10. It's an antioxidant, very important. L-carnitine is another amino acid that's very, very important for cardiac health. Amino acids are precursors to protein, and protein essentially goes into muscle fibers and they heal them. I mean, they repair them. So if you think about someone that takes BCAAs after they work out all the time, they're basically either trying to load up to build up more muscle tissue, or they're trying to do something to activate something here and there. They're precursors, right? Well, carnitine directly goes to heart tissue and helps lower inflammation and helps repair it. So you imagine as someone that has high blood pressure that's beating their heart all the time, that maybe has inflammation of the arteries, or that's taking a cholesterol pill, they might be at risk for some inflammation and damage. Carnitine is going to help repair the overused muscles that are in there. So all these athletes that are in the room, you know what lactic acid is. They're microfiber tears in the muscle, right? You have to get the lactic acid out of there so they can repair and build up. Carnitine comes in and goes and repairs that muscle. Arginine, L-arginine goes in and repairs that muscle. L-arginine goes one step further. Not only does it go in there and repair the DNA of the muscle fibers, it's a nitric oxide precursor, which is basically what's called a vasodilator, and it opens up the circulatory system. L-arginine is an incredible amino acid because literally if a person has hypertension or has high blood pressure, you could give them L-arginine and it would lower their blood pressure, almost as effective as some blood pressure pills that are out there. But I'm sure as hell certain that no doctor ever recommends arginine when a doctor with hypertension comes into their office. But if you think about this, if circulation is an issue, it's not just going to affect their heart. It could affect their toes, their hands. It could affect their brain, right? Because circulation goes into all those places. L-arginine literally increases circulation everywhere. So if a person had diabetes and they were losing sensation in their feet, you can give them L-arginine, and all of a sudden circulation is increased in their toes. L-arginine in high enough doses can actually help things like erectile dysfunction, which is incredible. So I'm going to give you the 2 cents on this. So Viagra was developed as a blood pressure pill initially, all right, which is incredible because if you think about it, most of the top 3 drugs ever sold in this country right now for the past 20 years are usually a blood pressure pill or a cholesterol pill. Because why? Everyone's at risk, okay? So while they were developing this new drug, Viagra's marketers heard about the drug's results, and the people who brought the results said it's not working, it's not lowering the blood pressure like we hoped, but there's this other side effect that happens with it. It shuns all your blood over down to your groin, and you basically have this whole other side effect that the marketer said that's genius because we can market that as this pill. So if you ever hear at the end of the commercial for Viagra, Cialis, they say don't take with nitrates or other blood pressure pills because you could have an unsafe drop in blood pressure. That's what it is. If you give a high enough doses of arginine, you can get similar effects, which is pretty incredible if you think about it. All right. And I had this older gentleman back in practice years ago who said he tried it and thinks it worked. I mean, we're talking high doses here, but arginine is a great one for circulation. Carnitine is a great one as well. CoQ10, I mentioned before. I'll go back to vitamin B6, and we have about 10 minutes. Vitamin B6, it's still one of my favorite vitamins because it's a cofactor in all kinds of things. The homocysteine that I talked about before, it's a simple biomarker test that you can look at in your blood work to see if inflammation is building somewhere in your body, most namely in your heart or your brain. If you don't think it's coming from your brain and you think it's coming from your heart, homocysteine will tell you whether or not the inflammation is getting out of control. Vitamin P5P or B6 will help lower the homocysteine. NAC will help lower that too, because NAC, N-acetylcysteine, which is the biggest liver detoxer you can find, if you cleave homocysteine, it turns into cysteine. And cysteine is NAC, the biggest liver detoxer out there, right? So you need P5P in order to do that. So if you think about someone that has inflammation building in their heart, and you see a homocysteine test that's elevated, you're thinking, I got to do something about this. But there's not a lot of medication that's out there that's going to lower homocysteine. It just doesn't happen that way because medicine doesn't look at it that way. They don't look at inflammation that's building. If inflammation is building, they recommend things like NSAIDs because those are anti-inflammation, right? Cortisone, anti-inflammation, right? If someone had inflammation tests they wanted to look at, they might tell them a bigger piece of the picture. You would order something called MPO and LPPLA2. And they're two acronyms for basically white blood cell enzymes that come in the form of inflammation. So let's say, for example, LPPLA2 and MPO are signals from the body that tell you that inflammation is building. So imagine that LPPLA2 is like, and I've used this acronym many times. Imagine like you're a parent and you leave, or you have a roommate, you leave, and your roommate or your kids decide to throw a party. All right? Everyone's over there. LPPLA2, that enzyme, are the neighbors. They're calling you saying, hey, so-and-so's throwing a party. Everything's under control. MPO, the other enzyme, are the cops. The cops are called, inflammation's running high, kids are flipping out and just jumping off the roof. Things need to be done now. That's essentially the two things that you can look at that's going to tell you that's inflammation building in the arteries, right? So if you look at a couple markers, you can say, hey, something's not right. Something is building. And if you think about this too, the MPO and the LPPLA2, they're inflammatory markers, but they can also come from things like red meat, all right? So can a steak kill you? It can, because it depends on many factors, not just the source of that meat. It's how you metabolize it. If you're eating a bunch of food that's deep fried in corn oil and trans fats galore, it's going to inflame your heart because when it breaks it down, your stomach releases a lot of those inflammatory signals that you will check in blood work and urine samples. And all of a sudden, you're like, wow, you're releasing a lot of this stuff. Could it be from your diet? You have to ask them that because most doctors won't. What do you eat? Oh, I eat a lot of meat. What kind of meat? Is it deep fried? Is it barbecued? Because those causes inflammation. Barbecue, especially those burnt ends, are like carcinogenics. Imagine you're trying to break that down in your stomach. Of course, there's going to be a byproduct of inflammation. And if that's the case, essentially, it's going to travel up through the bloodstream and it just chips away at your heart lining, your heart tissue, maybe something else. All right. And so those are tests that doctors have never even heard of, which is incredible because the only reason I've heard of it is because I've used it for a test that's a cardiac test. Right? It's not just heart rhythms. It's not just blood pressure. It's what inflammation is building that we can't see. And that's really what we need to address. So when you go to treat heart health issues, there can be nutritional things that you look at. There can be labs tests that you look at, not just cholesterol, right? Because cholesterol is just one part of it. But I'll leave you with this last thing. If you have someone that typically has high blood pressure issues, and has high cholesterol issues, I guarantee you it's not just those two things that are going on. There's something else going on. Is it poor diet? Is it poor genetics, poor metabolism? What's going on with them, right? You have to look at the bigger picture. You, in your community, in your line of work, will talk more about nutrition and diet than any doctor ever will with your clients. So it's vital that you have these conversations because if they keep saying, hey, I'm doing keto, but I'm eating tons of butter and bacon with it at every single meal, you got to tell them, I don't think anyone's ever healthy off of just eating dairy and meat. I'm just telling you, it's not a good idea. And it's incredible because the references that doctors use for nutrition will say, let's go to these designated nutritionists. And a lot of them will still recommend things like whole wheat bread for a person with cardiac issues. My dad had open bypass surgery last year. He had 5 stents in his heart before. He has coronary artery disease. He had 98% blockage of what's called the black widow. The widowmaker, I'm sorry, which is the left ascending coronary artery. And if you have blockage of that, it filters the whole heart and it will basically kill you. There's a couple other blockages out there, like 70, 80%. It was significant. So it was interesting. So when I was there at the heart hospital, which is great, the surgeons, incredible people, some of the best surgeons in the world. Like, it's incredible. You talk about heart, the heart hospital here is one of the best heart hospitals in the world. Charles will back me up on that. They explained everything to us, but what they didn't explain were his labs. And so I happened to go walk over to his labs, and I looked at it, and I was looking at it. After they got done, I said, Dad, you're diabetic. I've never been told that. And I was like, yeah, you're diabetic. I've been telling you for years, I think you're a pre-diabetic, and now you're a full-blown diabetic. Well, the doctors never said anything about that. Okay? Are they going to say anything about it now? Like, they don't think it's related, which is incredible. But there's this diagnosis called metabolic syndrome. And metabolic syndrome is a harsh way of telling someone that they're fat and it's unhealthy. It's incredible. You can't go up to someone literally if they're fat and say, you're unhealthy, you're fat, and you need to lose weight, but I can give you a diagnosis that basically says the same thing because I have labs to show you that you're unhealthy. Metabolic syndrome has bad blood pressure, bad cholesterol, bad blood sugar, and you have a big old gut. And they literally say the measurement of your waist circumference tells you how healthy you are. It's weird, but it's true. So when I see someone like this, I'm not judging, I'm analyzing. And I'm thinking, wow, all that shit goes in together. Cholesterol, blood pressure, glucose, if they're a guy, low testosterone, low sex drive. If they're a woman, estrogen issues, thyroid issues, adrenal issues, infertility, sleep, like it's all connected, right? Because like I said from the beginning, the heart filters out all the blood. So whatever you're putting in there and metabolizing and producing, it's going to carry out to the rest of the body. It's not going to stop. So if you keep putting shit in there, it's going to carry shit to the rest of your body. And then if you produce shit, then it's like, we're going to carry it out because we don't know any better, right? So the heart is incredible because we work out every day knowing oxygen and exercise is going to help increase blood flow and make us better. But I will tell you this, talk to your clients, especially the ones who are working out 2 to 3 times a day. And you know these people. You can put a little damage on the heart because once again, it has to have recovery. So keep in mind that anytime you talk about recovery, it's prevention. And that's when it comes to heart disease. Prevention is preventing inflammation from occurring. The recovery aspect of it is we beat this thing to the ground. Give it some love afterwards, right? Give it some carnitine, give it some arginine, some CoQ10, B6, some NAC. Make sure you're eating some healthy fats. And there's nothing wrong with plants. I love plants. Find out which ones work for you. But that's kind of a whole approach. Now, going behind the scenes, do what you need to do. I'll leave you with one last little piece of advice. If you're really not sure about where to go from the heart health and it runs in your family, there's one test that everyone should know about that they can get on their own. It's called a calcium score test. It's a $75 test. You can walk in without a prescription to any imaging center, and they will analyze the calcium that's building up in your arteries. And they will tell you whether or not you have calcification. Most doctors still don't recommend this to their patients, even though it's available. Now you know. So the second year someone say, hey, I've been worried about this, my dad, blah, 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 go get this test done. Maybe run this couple of these blood panels and see where you're at. Because it's basically heart attacks come out of the blue, right? Guys know it because they have chest pain, numbness down the arm. In women, it's the silent killer. There's no symptoms with it, really. It just kind of happens. So do what you have to do in order to prevent it. Questions, comments? Yes.
I know that heart disease is the main killer of women, and I'm wondering why it's different. Do hormones play a part? The products that women use more for control, like why would it be the #1 killer compared to men?
So our body's response system for stress involves neurotransmitters, white blood cells, and essentially hormones. So if any of those are off, it throws everything else off. And so if inflammation is kind of building and there's like I said, low B6, you're not able to process inflammation. And what happens with every one of our cells is that each cell has like, I don't know, I'm gonna throw a number out. Let's say you have 30 receptors around each cell. There's probably like 1,000. But each one of those receptors, if it gets activated, it does something to that cell, and then that cell kicks out something else. So if there's inflammation building, what happens is the body just gets activated in inflammatory pathways. So that means all the pathways are checked. You imagine like you're on the airplane and check, lift, like inflammation here, inflammation in the heart, inflammation in the brain, inflammation, and it just cascades. And if it filters out through the entire body, it has to go through the heart at one point, right? So the heart has to filter out whatever is being pumped for the rest of the body. Heart health has also been linked to good hormones. And so guys who have low testosterone tend to have poor heart function. Because I think there is a connection between testosterone and heart health. And the same goes with
HEPPP, HEPPP is the way I remember it. It's hot flashes, exhaustion, pain, pale, and puking. If you have 2 of those symptoms or more, then it's a female heart attack, basically, and you should get to the hospital. So that's the easiest way to remember it. For guys, it's
so for like anything.
yes. If your jaw is hurting, that's a big sign. If your jaw is hurting and you're pale and you're puking, it could be the flu. It could be you're sick. Go to the hospital and see.
Yeah.
I think also that women just complain about this.
We do have a-
well, there's a higher pain tolerance
Yeah.
for sure, right?
Yeah.
There has to be some-
Yeah, and it's just like whatever. Like I complain about a little freaking. I get an ambite, I'm like crying.
My mom has pulmonary
good.
hypertension.
Turn on
That
that.
by a drug called Vioxx. Everybody's super
When you find some time to look up.
Well, see, that's what my dad did.
Or at least let me know when you're.
His first heart attack when he was like, I think it was low 50s, I think, which is pretty young for a guy, regardless, right? And when he got down out of the hospital, they asked us what they say. And this is way before I was in medicine and all this. And they're like, yeah, it says, gotta watch my diet, gotta lower the sodium, fat, sugar, all that stuff. But lost a ton of weight, got really healthy, and he got sick of eating just turkey and chicken all the time instead. So, fast food kind of comes into play and all that. And I remember I told him one time, I said, Dad, I think you have like a sensitivity to like meat. He goes, what do you mean? I said, well, I don't think it responds well with you. So I said, I think you got to cut out the meat. I also think that will help. The sugar will help too, but you have an allergy because you can't metabolize it correctly because you have coronary artery disease. So in my mind, I would think that those fried foods and the fast food would inflame this heart a lot easier than meat. So kind of genetically speaking, as a person with diabetes risk, they have more risk of getting blood sugar to be an issue. But they the heart thing is an incredible thing because the surgeries that they've had nowadays are awesome. He recovered so quickly.
I need that from you guys. I need you guys to say, yeah, this time, this day, you want to meet? I'm like, yes, can, boom, done. You know what I mean? That way, like, I feel like there's a.
But he's
I wanna
like
be able to
so
figure out
healthy, like
what
it's
I use.
super.
On paper or
On
trial.
And I know I
Not
can
even
do those,
probably
but
with lab if
it's like a week and you
saw
saw
him.
Doctor,
Doctor.
but he does believe in like food and exercise over drugs.
Good, okay.
He's very, very
Yo.
smart. But he definitely,
And
and he loves